Good afternoon, I'm Anna Davidson. I'm presenting today on behalf of OzSAGE in regard to the floods in Queensland and northern New South Wales. Before I start, I'd like to acknowledge the country that I'm coming from, Biripi land, and I wish to acknowledge and pay my respect to the traditional owners of the lands on which we are all joining from today, and their elders past, present, and those who are yet to emerge. I'll just put up the slides for today. Today, OzSAGE is urging the federal government and state governments to act immediately to prevent further illness and death in relation to COVID-19 and the floods. The floods in northern New South Wales and Queensland are a public health catastrophe, which is only going to worsen in relation to the transmission of COVID-19 and increase the numbers of people with severe illness, while local health systems are already compromised by flooding and increased demands. The low COVID vaccination rates in northern rivers of New South Wales area and southern Queensland will make this particularly high risk for COVID-19 related severe illness and deaths. Northern New South Wales also has a large Aboriginal population, which is disproportionately affected by floods. At least 17 people have died and large numbers of people are homeless, especially in New South Wales. They're crowded together in temporary accommodation or evacuation centres without access to secure supply of food, water, regular medications or healthcare. This is a photo of an evacuation centre in Lismore. So when we talk about healthcare, access to healthcare, this includes things like pharmacies, optometry for people who've lost glasses, doctors, hospitals. Hospital in Ballina was evacuated and it is still under pressure in terms of delivering services. It's the same with primary care services in all these areas. So there are immediate and delayed public health effects of floods. A surge in COVID-19 cases is likely in the next several weeks, particularly given the crowding that you've seen, the lack of access to PPE, and just the state of living that people are in while they're trying to recover where they live and find somewhere to eat and basically get their lives back together. Hospitals and staff have been affected by flooding, and this is going to increase the hospital capacity due to the flood, injuries, exacerbation of chronic illnesses due to the lack of medicine, greater number of gastroenteritis cases and other flood-related illness, and they leave few options for management of a high caseload of COVID-19. And it's just going to put further pressure on overworked staff. Currently, I personally know of many healthcare workers that live in the region that are homeless. These are nurses that work at Lismore Hospital that live in Ballina. They are anaesthetists, they are staff from the Lismore-based hospital and Ballina hospitals. So all aspects of public health are connected, and cascading failures may occur if any one aspect is not addressed. And I guess the reason we're really talking today is access to hospital and ICU care is an important predictor of mortality from COVID-19. If people with severe COVID-19 cannot access hospital care, the death toll from COVID-19 will be disproportionately higher in flood-affected areas. We know that people have been trapped in mudslides and road collapses, and we know that outlying areas in these regions have still not had full contact for locating people that are stuck in these areas due to mudslides, roads cut, bridges washed away, and also there's a lack of communication and internet. So these people are completely cut off, and there's as yet not a full reconnaissance of what need is actually there. Safety and wellness checks are still ongoing and communication is limited. And sanitation is a major risk with environmental contamination from raw sewage. We've seen that over and over, and it's why you've seen so many photographs of so many things being thrown out that can't be dried out because of the contamination from the sewage that's gone all through these regions. So we're calling on governments to give urgent provision of safe housing, food, power and communications for flood displaced people, priority housing for healthcare and other frontline staff who are displaced due to flooding, urgent attention to sanitation, sewage disposal and safe water, urgent supplies of essential medicines, masks and COVID rapid antigen tests, urgent expansion of health systems and hospital capacity, including staffing and evacuation plans to ensure adequate infrastructure for medical evacuation where it's needed, expansion of COVID and other infectious disease testing and public health laboratory capacity. We need urgent vaccination campaigns for COVID-19 and other vaccine preventable illnesses with mobile vaccination clinics deployed to the affected areas. We need increased ADF logistics support to affected areas, establish surveillance for immediate and delayed health effects of the floods to enable rapid intervention when required, and provide updated daily statistics on injury, illness and death arising from the floods and aftermath. Counselling and support for communities undergoing multiple trauma events, and release of the federal disaster funds to enable the above. I lived and worked in the Lismore region and Ballina regions for over 12 years. I went to university in Southern Cross University in Lismore, and that is a photograph of where I used to work. It's affected all levels of the community, and it's no simple task to get this done. We actually need people there on the ground and helping. If people have questions later about the area or people that I've been speaking to and where the need is at the moment, I'd be happy to. I have friends that are currently working up there. They own businesses that have been turned into evacuation centres and food banks, and people on the ground helping with the cleanup, and also people that are displaced. So these are the OzSAGE stats for the week. So there've been 330,953 reported cases in the past 2 weeks. 55% of all cases are below 30 years of age. 210 active aged care outbreaks with 2,215 new cases and 112 new deaths in the last 2 weeks in aged care outbreaks. 76.54% of the Australian population have had at least one dose. 46.25% have received the booster dose. So in the last 2 weeks, with hospitalisations and deaths, there's been 545 deaths in the last 2 weeks alone. And you can see the breakdown there with New South Wales, Victoria, ACT, Queensland, South Australia, Tasmania, Northern Territory. These slides will all be available on the website, OzSAGE.org. I'd like to draw your attention to our open letter that we have launched about a week ago. That's the address for it. I'll just stop sharing and get Amy to put that up. That will be put up on the OzSAGE website, OzSAGE.org, for people to sign. We are basically calling for the government to continue to protect people from COVID-19 going forward, and particularly clinically vulnerable and at-risk communities. And if you'd like to sign that, please visit our website and click on the link and sign the letter. Thank you.
Thanks, Anna. Can I just ask a question in terms of what, from your knowledge and speaking to people in the area, what plans are there in terms of housing and accommodation for the people who are homeless?
So that's, there's actually not a lot of plans at the moment. There's evacuation centres being more, I guess, semi-permanently set up, but there's the sheer number of people that this involves. People don't know how they're going to be housed. I know of people that have been evicted from tenancies because they're unlivable, but they have nowhere that they can go. Some of those, actually one of those people has COVID, and they have nowhere to go and isolate, and they have no capacity to rent somewhere else, and they're currently fighting in the tenancy tribunal to try and sort out not paying rent for a place they can't live in, and they can't find something else. So I think there's real issues on the ground with housing going forward. We are talking of tens of thousands of people have been had flood damage with sewerage through their house and basically making them unlivable. The reality, this is going to take not 1 or 2 or 6 months for this damage to get repaired, but probably well over a year. And there is no sense of what's going to happen in terms of housing going forward. There's a large population of students, there's a large population of low income and at-risk communities, and there's real concerns about where people are going to live and how they're going to replenish their clothing, their personal items, you know, everything from phones through to refrigerators.
And so if any of the media has questions, they can just type the questions in the chat, please. What about roads and access, and what's happening in terms of food, water, essential medicines, vaccination clinics, etc.?
So Friday, things really started to slightly open up. So you could get through, particularly up north, to the Lismore Casino area by going through going through Casino, the back way. Then on Saturday, the highway opened north, and then Sunday, I think it opened for south as well. Oh, sorry, the other way around. So south and then north. So ADF started moving in over the weekend. I know there was 900 odd ADF staff arrived then. Food trucks started arriving on Friday and Saturday. For example, one of my family members took up emergency supplies of disposable serviettes, paper plates, things that people could actually eat off, because everything is gone. They haven't got a plate to eat on, a serviette to wipe their face on, a fork to eat, or food, or electricity to cook it on. So food has started arriving. The supermarkets were basically knocked out, and those that weren't completely knocked out by the floods, then they got completely wiped out by people buying food there. So there's huge food banks that have been opened up. There is food available, so you can get a meal, but most people haven't had access to petrol or diesel for their cars, or their cars have been totaled in the flood as well. So just actually getting around and getting to food. While food is flowing now, the Sikh volunteers are up there serving meals. There's lots of community groups now cooking, but the reality of getting around in a flood-torn area is much harder. There's no public transport. You don't have your own transport. It's filthy. You don't have clothes. You're trying to get around. So I think that the reality is it's a big ask.
And what about the health system? Like we know that Ballina Hospital was evacuated. In terms of the, I think Lisa Ma has just asked the same question.
Yeah,
staffing.
So it's a real issue. There are healthcare workers that are still stuck and can't get in because their roads or bridges are cut off. But there's also a major amount of healthcare workers whose homes have been annihilated. So and they're busy, you know, trying to pull out carpets and find animals that they might have lost. So it's really impacting on the capacity for healthcare workers to make that choice about do they try and rebuild their own life and find somewhere to live, or do they go to work? And so the nurses that I've been speaking to, particularly from Lismore base, you know, the two that I've spoken to just yesterday, both their houses completely annihilated. They have nowhere to live. They have very few clothes. All their shoes are gone. So the impact comes not just from, you know, with someone hurt in the flood, but if you have nowhere to live and no car to get, one of these nurses lives in Ballina, so her car got totaled, so she can't get from Ballina to Lismore anyway for her shift. And even if she could, her home is so trashed that she's currently throwing out every item that she owns. So yeah, I think the reality of the impact is so much bigger than thinking, oh, that flood's over and they're cleaning up now. These are people that have got nowhere to live and no car.
So do you know on the ground how the hospitals are managing right now? Will Ballina Hospital be reopened? And how is Lismore Base Hospital managing?
So Lismore's struggling for staff in terms of just the impact on everyone who works there. And it's open. I know the water went right up to the edge of Lismore Hospital and lapped up to the mental health unit and to the oncology unit. Fortunately, it's quite high, but it did have to run on generators for a number of days. The electricity's back on at Lismore Hospital, which is fantastic. And it also is, there's a number of houses that's on the same grid as Lismore Hospital, but most of the rest of it doesn't have power. Ballina Hospital, the cleanup is, my understanding is it's still ongoing, but it's also affected general practices as well. It's not just the hospitals. You know, there are general practices that have been completely wiped by the floods, lost their computers, you know, and yeah, so it's primary care as well as tertiary care that's been impacted, as well as allied health, pharmacies, you know, optometrists. There's no area it hasn't touched.
So is there some kind of mobile medical response?
So I'm actually trying to find those things out at the moment and looking at how can other general practices perhaps assist, and how can that be done. There are some rules around telehealth about how to access services from the federal government, having to be a patient in the previous 12 months. So we're trying to look at how can we help those areas by offering general practitioners who are happy to do phone consults with people that may not be able to go to their normal practice or may not have a practice. So there's things going on the ground, but nothing is up and running as yet. And the other reality is most people also don't have a phone. You know, the phone services are really patchy. So really getting some primary care on the ground would be good, and calling perhaps for an OzMAT response or something up there so that they can get some medical services available, and available where people are, not that they have to travel to, because I think that's really important. When travel is so difficult, when you don't have a car and there's not public transport, and also you're just in trauma, that the medical services need to go where people are.
Okay, any other questions from anyone? One last question, Anna. We've heard certain commentators saying, you know, sort of blaming the people who live there for choosing to live there. Do you have any comment on that?
So I guess, I mean, I lived there. I lived there for 12 years. I went to university, I worked there. People move to that region for all sorts of reasons. There's been no reason not to live in Lismore. It's actually a great area, the whole Rainbow region. But it's also, people have lived there because it's inexpensive, and people have to live somewhere. The reality is that people live where they either go to university, they work, or they can afford, or they have family. So I think people fall into all one of those categories, and that is not necessarily something that you can blame people for. And I think that it's very short-sighted to think that it's just affected, you know, one section of the community that you may or may not value, because the reality is everyone has a reason to live in Lismore, and everyone has a right to live in that area. The reality is people have been asking for flood mitigations, well, since I lived there. It is a known flood area, and they have done flood mitigation works, but the council have been wanting to do more, but haven't been able to access additional money. And going forward, I don't know what that's going to mean for the area, but you can't shift the personal responsibility onto somebody who's just carrying out their job as a nurse at the hospital, that they shouldn't live in Lismore. Like, that just doesn't make sense. If it's going to be looked at as an issue going forward, then that needs to be a whole of community response with a whole of government response.
Thanks, Anna. And what about the Aboriginal communities? There's a lot of Aboriginal people who live in that northern New South Wales area.
Yeah.
Are you aware of what the situation is in those communities?
You know, unfortunately, Aboriginal people have been very affected by the floods, just like everyone else. I think the loss of the Koori male in Lismore is something of it's actually a loss of a national treasure. It's been going for over 30 years, and it's incredibly well-respected paper nationally that gets information out for the Aboriginal and Torres Strait Islander communities. I think that is something that we should be looking to support, help to get back up and running. On the ground, there are community groups that are really looking at trying to figure out what's going on, who needs help, but there's homelessness, there's need of medical assistance and access to medications, there's transport issues, there's school issues. You know, kids don't have a school book. And this is that they've lost their school bags, they've lost their school shoes, the school's completely trashed. You know, so there's communities that are already at risk are going to be disproportionately affected by this. They're less like people that may have socioeconomic pressures on them will have less insurance. They're less able to replace goods that are missing, even if they don't have insurance. And often housing is more fragile. So if you are renting and that house is then completely annihilated, then where do you go and live? There is no housing stock spare. Do you then move, you know, you've got children at school, they play sport, you've got involvement, you've got work, you've got university. So I think that the ongoing issues for Lismore and that whole region are huge. And you know, like I said, it needs a whole of community response, and it needs to look at the parts of the community. It's not just one large homogenous group.
Thank you very much, Anna. Any other questions? Okay, we might close the conference then, and everything will be up on the website this afternoon. Thank you very much, Anna.
Thank you. Thanks, Raina. Thanks, everyone.